It's our job to make sure that we find what is individualized about each of them and play to their strengths and make sure that they are getting what they need. So the help that they need to reach and become their best selves.
Hey Alex, how
Hey
are you?
Alyssa, how's it going?
That was a great weekend. I've got
We're not sleeping busy projects going.
Super busy. I had to navigate that new journey for
All right, I
him.
appreciate that. Thank you, Shannon.
I think some of the misconceptions that we do see a lot is that, especially in autism, is that every child who's been diagnosed with it shows similar symptoms, because we have children. That's why autism is called considered a spectrum disorder. There are children that have very few issues or symptoms, or very few ones that we can see anyway. And they actually do very well typically until they don't. And that tends to be when you see the low frustration tolerance or the anxiety that comes along with not being able to perform. But we also do see children that are very low down on the spectrum. They need a lot of supports and everything, but not all children show or even have the same level of need. So one child on the spectrum could be totally different. We work with all of them, no matter what their level of need is. My program is mainly supports coordinators. So we are looking for services. We are directing them to, even if they're outside providers, to places where they can work on the very individualized and specific needs that they personally have. And we also work with their families, so their parents, their grandparents, whoever their primary caregiver is, in order to make sure that they feel like they have enough support and assistance as they go through the challenge of raising an individual with difficulties. And the same goes also for our children who have just the standard developmental disability, or like cerebral palsy or Down syndrome, or have a cognitive disability. They're not all the same, and they don't need all the same things. And just because one child has a lot of behaviors doesn't mean another one is. It's our job to make sure that we find what is individualized about each of them and play to their strengths and make sure that they are getting what they need. So the help that they need to reach and become their best selves. Well, the best place to start is always the primary care doctors. They know the most. Pediatricians are going to know the most about what is developmentally appropriate for children in their specific age bracket. If the parent is having concerns and the doctor is also seeing some of the same things or share some of those concerns with the parent, there are definitely plenty of ways to get the child assessed. So pediatricians are not going to be able to do the full assessment. They will do some checklists to see if maybe the child's behaviors or symptoms are at risk for coinciding with the diagnosis of an intellectual or developmental disability. Those do exclude things like cerebral palsy and Down syndrome, since those are also considered medical concerns. But a child who's just no longer developing on the same rate as its same age peers, definitely first place to start would be PCP or primary care physician. And then, of course, if they have Medicaid or Medicaid adjacent insurances, they can call the mental health agency in their county of origin. For Macomb County, they can ask if we can do the testing. We do get referrals in Macomb County for testing, but in Wayne County, we are not allowed to do autism testing, but we do other types of testing in Wayne County. We'll do cognitive testing to see where their IQ falls. We'll do adaptive functioning testing to see how they're able to function on their own, and self-care, communication, and in the community versus other individuals their own age. And we do a lot of that. Or we also do academic testing, behavioral, and emotional testing. A lot of that goes toward our own consumers if we're trying to figure out if they're in the right program. So sometimes we'll get a kid that comes to us And they did have an autism evaluation, but they didn't meet criteria for autism. So now we have to do a couple more assessments to see if our program is the best fit or if it would be best to place them in like child outpatient, or if they're young enough, infant mental health. The same thing happens from the child outpatient side. Therapists may be having struggles or concerns about their kids' ability to engage their program, and so they'll send them to us for testing to see if they're in the right place. And that's what we mainly do for Wayne County. In Oakland, again, we don't have testing services set up to my knowledge just yet. It's probably something that when we meet with them to reestablish our contract, that we'll probably end up putting in there. But right now we don't do it for Oakland County. Yeah, so there are things that they can get without having a supports coordinator. There is some home help services that they can go through there if they have Medicaid that they're able to get. There's a family support subsidy that they can call the county for. They do not have to have autism to have that, but it is a little bit of a stipend for children who have a developmental disability or who have some kind of emotional or learning disability written into their education plan from school. They can get a little bit of a stipend to kind of help with anything that they may need for that child. So if it's extra tutoring services outside of the school, they can get a little bit of money back to receive that. The services that we typically have in home that we refer to are applied behavior analysis, which is a behavioral therapy that's treatment of choice for children with autism. A family can receive that even if they have commercial insurance. There are plenty of ABA providers that take all kinds of insurances. They don't necessarily need a supports coordinator. So our intake process looks pretty much like the intake process for the rest of the agency. They get their intake done by an intake analyst. She sends the information over to me, and I get them assigned with a supports coordinator who sits down and does their treatment plan with them. Our treatment plans do look a little bit different from an outpatient therapist treatment plan. We focus on the person's needs. So the goal doesn't become, I want to learn how to manage my anger. The goal becomes, especially if the child isn't able to talk, because we do service children as young as, 0. As long as they have a confirmed intellectual or developmental disorder, we can see them any age. So depending on how verbal the child is, the treatment plans look more like we want our daughter to speak more. We want our daughter to work on her social skills, things like that. So we focus on the types of things that the child needs to improve in order to live their best life and be their best self.
That was a great weekend, Paul.
And they're not doing any easy projects coming.
I had that new surgery for the weekend.
Thank you, Shannon.